Please welcome my next guest, Jennifer Blevins, family nurse practitioner from Novant Health Express at Walgreens, located in Leland. Jenna, it's so great to have you here today.
Oh, thank you.
I think it's been a long time since you've been on our show.
It's been at the very beginning when we first opened the little Express Care Clinic.
That's right. So you've come a long way. Boy, I can't wait to hear about what all has changed. So before we start, tell us a little bit about your background and where you went to school.
So I'm a family nurse practitioner. I went through Walden University for my master's degree, but also went through Old Dominion University for my bachelor's. So that's pretty much my schooling there. I've been a nurse practitioner since 2016. I started more with family practice and then merged over to more of an urgent care setting for a good while, and kind of do both family practice and urgent care, same day problems.
Did you always want to be a nurse practitioner?
So I started out my career as a lab technician years ago. So
that's awesome.
I figured when I was doing that, I knew then I wanted to do more. So I went to school for nursing and then just kept going through there. Yes.
Awesome. Kind of from the ground up.
Yes, definitely from the ground up, for sure.
Yeah. So let's talk about the Novant Health Express at Walgreens. That is a mouthful. What kind of patients do you see there?
So we see a lot of same-day appointments, same-day problems, something that just comes up more acutely with the patient. Yeah. Sickness, illness, urinary issues, pretty much anything that is not their normal everyday issue. We do follow some family, practice guidelines there, because we are an extension with the Leland family office.
Yeah, the Oceanside Family Medicine.
Yeah. So a lot of times we also act as an extension to their practice, and we see anyone and everyone, but sometimes if patients can't get in to see their primary care provider for a certain amount of time, we are that person, that middle person as well. We make sure that they are followed with their medicines, their chronic issues, any kind of acute needs that kind of come up too. We're there.
And like weekend coverage.
Yes, so we are open on weekends as well, and that is a good extension, to
that's awesome.
the weekly hours.
Yeah. Can you check in online for an appointment there?
Yes.
Did you go through the Novant Health, or did you go through Walgreens?
You go through Novant Health.
Awesome.
We are not actually Walgreens. We're just in the facility of Walgreens, but we still provide, urgent care services to the patients of the practice and to anyone and everyone that needs something.
Yeah. It's really nice too. When I toured that, I was so surprised at how this small area could be so accommodating.
Yes.
And so nice. I mean,
it is nice.
I love
small.
the doors. I'm all about those doors.
But it is very, we have 2 exam rooms. We have, a patient bathroom, and we also have our lab in the office.
Yeah.
It's compact, but it does a lot of good services.
Yeah. So let's talk about the types of patients you're seeing. I know summer was a really busy summer with respiratory bugs and all that kind of stuff, especially in kids. So have you seen a lot of that, of respiratory issues?
So there has been a very big uptake of respiratory illnesses in kids and, adults in general, especially here lately. I think, since school starting back again, that has really brought on a lot of the respiratory, viral illnesses. There's been a pretty good uptake with, RSV in our child population. And we definitely see a lot of that, treat that, as well as educate, the families on signs and symptoms to watch for more of a respiratory distress that we would require them to have further evaluation, that type of thing. But for the most part, we see all ages, all the way from birth, all the way up.
Really? I didn't realize that.
Yes, we do see all ages. Yep.
So this time of year, getting into December and what have you, I imagine we're getting into flu season. Have you seen any flu yet?
Oh, it has started.
Really?
Yes. This week, have had a lot of positive flus. There's been flu A, definitely there's been a couple of cases of flu A and B.
Really?
So, I mean, it's out there and it's pretty common this week.
Geez, I'm glad I got my flu shot early. I got mine October 1st.
Yes. It's been it's definitely getting more prevalent here in the last week to be seen.
Yeah. So if you have a cold or the flu, when is it the right time to see you? When do we need to come in?
So honestly, I mean, with testing for COVID and all of that, we all have access sometimes now to the home COVID tests.
Right.
We can do those at home. We also offer more of the send-off COVID testing at the clinic at Walgreens. We're usually getting about a 24-hour turnaround time for our COVID tests, the send-off PCRs.
Right.
And, you know, we do the in-house influenza testing. So that is something that will be done, you know, during the visit there. If somebody has symptoms.
For both A and B?
Yes. Okay. So, you know, honestly, if there's a concern, I would just come on in. Yes, I would definitely go ahead and make that appointment. We do offer online scheduling, open scheduling through the website. We try to accommodate as much as we can walk-in patients. We do have appointment slots as well. People can also call the main Oceanside office to get an appointment scheduled too, if for some reason they have online difficulties or computer problems. That's another way to do that. You can also walk in and we can see what we can do then. So those are all the options.
It's good to know that you have walk-ins. I mean, you may have to wait a little bit.
Yes, we try to accommodate that as much as possible. There's two of us working, usually myself and another CMA medical assistant. So if there's place that we can like fit you in, we definitely try our best to get that accommodated. Also, if there's any like openings in the schedule, if someone doesn't want to wait and they want to come back, say at 3:00 p.m., then we reserve that spot for them and go ahead and put them on the schedule if they're willing to come back during that time. And we make sure we offer all those options.
What are your hours?
So Monday through Friday, we are open 10 to 8 p.m. and we do stop for lunch from 2 to 3. That's Monday through Friday, the 10-hour days. On the weekends, we are open and available from 10 to 3.
10 to 3. That's great to know. Yeah, because sometimes on the weekend, my kids always got sick on the weekends.
Yes, but it's always after hours too. So at least we're open in extension to like the primary care office.
Right.
We have those extension hours too.
Yeah. What kind of vaccines are you giving? They're at Walgreens, correct?
Yes. So in the little clinic, the Walgreens Express Care Clinic, we are administering flu vaccines.
Great.
We do those. We also offer tetanus vaccines if someone has a laceration. We will also do that a part of their visit that day.
Awesome.
Puncture wounds, we would update their tetanus, that type of thing as well. We do PPD testing as well for tuberculosis. Usually if it's other vaccines, we would refer them to the Walgreens site at the pharmacy for their COVID vaccines, shingles vaccines, things like that.
Well, Jennifer, it's been so good to have you back on the show today.
Well, thank you for having me.
Yeah, this is the time of year where we have to start talking about colds and flus and all that
Well,
kind of
it's
stuff.
coming. It has already hit.
All right.
And this week has been very busy with that.
All right. Well, thanks so much, and I hope to see you
welcome.
soon.
Okay, thank you.